Basically, bronchitis, whenever in a medical field itis comes, it is defined inflammation. So bronchitis is inflammation of various bronchioles. Bronchioles means airway of the body, which is the part of the lungs. So it is inflammation and swelling of the airway, what we call air tubes of the lungs. And usually it is of two types. It is acute and chronic. It depends on the cause of the bronchitis. Many times we see in day-to-day life, viral infection leads to chronic cough and chest heaviness and wheezing. So this leads to acute bronchitis. This type of patients are contagious. Not all bronchitis are contagious. Only acute bronchitis are contagious, which has viral etiology behind them. Bronchitis is of two types, acute and chronic. In acute cases, it is usually viral infection or sudden exposure to fumes, dust, or irritants in many patients. And in chronic, when the cough is persistent for a long time, it is persistent for months. And in chronic, it may be due to chronic bronchitis. We all know that COPD, one of the type of patients are chronic bronchitis patients. Then in smokers, it is the leading cause, air pollution or occupational hazards. These are the causes of bronchitis and chronic bronchitis. Generally, in chronic bronchitis patients, they usually have cough, which is maybe dry cough or it may consist of mucus, and then persistent chest heaviness. They will feel chest heaviness and discomfort, usually during walking, like shortness of breath, and many times they have wheezing sound. Bronchitis is of two types, acute and chronic. The first and foremost important thing is history. Since how many days patient is having symptoms of bronchitis, so depending on that we decide our test. The basic tests which we routinely do in such patients are chest x-ray, pulmonary function test, blood investigation like complete blood count, and IgE, serum IgE. And many times when patient has persistent bronchitis, like in chronic bronchitis, we go for pulmonary function test. Many times we require CT scan also, and bronchoscopy, SOS basis, depending on the patient condition. If patient is having acute bronchitis, it is usually due to some sort of viral infection or infection other than virus. Depending on it, we have to give medicine and good hydration and rest. It is the appropriate for the patient in acute cases. But in chronic, we have to go for the cause of the bronchitis. We have to reverse it, like we have to avoid smoking. Then we have to avoid exposure to irritants, and we have to avoid occupational hazards. Many times, poor hygiene is one of the cause. So lifestyle changes is one of them. If we come to drugs, so there are drugs which are given in such patients like antibiotics. Many times if patient is having infection or if patient is having tuberculosis, in such cases, we have to treat the TB depending on the test, what our tests are suggesting. Then bronchodilators, mucolytics, these are the basic medications which we use to treat chronic bronchitis patients. We use, and our ancestors, even our dadis have told us that whenever we had cough, you just take adrak ki chai and all those things. So definitely this ginger, turmeric, they have anti-inflammatory and antioxidant properties. So due to their anti-inflammatory properties and antioxidant properties, they provide symptomatic relief to the patient. They reduce the viscosity of the mucus, so it will come out easily, and this reduces the airway congestion, and it helps in symptom reliefs. As we go for turmeric, turmeric has coumarin as a content, and coumarin is a well-known potent anti-inflammatory agent, and it is used in many medicinal uses also. In concern with steam provide humidifier, it liquefies the mucus, which leads to relief in symptoms. So definitely these products helps side by side with the medicine in cases of bronchitis. It is of two types, acute and chronic. In acute, viral infection is the most common cause, among which flu is very well known in India. Whenever there is seasonal changes and the patients who have tendency to have these symptoms intermittently on changing of symptoms. They should avoid going to the crowded place. They should avoid significant temperature changes during their routine life, and use preventive measures like wearing masks and all those things. In chronic bronchitis patient, smoking is one of the most common factors. So quit smoking, avoid smoking, as well as secondhand smoking. If your roommate or your friend is smoked, it is not a secondhand smoke. It's smoke, and the fumes may affect you, not him. So avoid secondhand smoke also. So maintaining good hygiene during your daily lifestyle, regular exercise, especially pranayam. Those who have tendency of allergic rhinitis or those who have asthma, they should regularly do pranayam. So it avoids accumulation of mucus in the airway. In the meantime, it provide it strong up the local immunity. This will help in preventing the bronchitis.